Today I'm going to introduce the concept of economic operators. This is something new to the medical device world that's introduced by the Medical Device Regulation and the 2016 version of ISO 13485. It's not really a new concept, it's something the whole time. We're used to the idea of a supply chain where we start off with a material. Maybe somebody buys that material, makes it into components, somebody else puts those particular components into a sub-assembly, that maybe goes to a contract manufacturer who performs some various special processes, goes on to the manufacturer of the medical device, the person who assembles all the bits and pieces from the various sources together and may continue to place the device on the market, or put it forward to an importer, distributor, representative or agent. And this is very much our conventional supply chain model. Now, because a medical device doesn't become a medical device manufactured, we really start our consideration at the manufacturer. So the manufacturer is an economic operator, but they're a key economic operator, and we'll discuss them somewhere else. By economic operators, we're really looking at the people further on down the supply chain after the manufacturer. So we forget about the role of the manufacturer and the early stages. We're looking at the distributors, importers, representatives, and agents. The idea came about when the European Commission first started promulgating these regulations in the early 2000s. And the idea is that the economic operator is any business or other organization which supplies goods, works, or services within the context of market operations. That is, taking a CE mark product and actually moving it through the market to a customer. So it's that stage again, downstream of the manufacturer. Okay, so economic operators are defined in both medical device and the in vitro diagnostic regulations in Article 2. Manufacturers are dealt with in Article 10, and they of course have the bulk of the responsibility for the medical device. But the other players have joint and several responsibility, and those are authorised representatives. So if the manufacturer is outside the European Union or free trade area, then they need an authorised representative inside. Importers, the people who bring the product in, that may be the authorised representative, they may be the same person, they may not. So one person or one legal entity can have more than one role as an economic operator. Distributors, again, the importer may be a distributor, there may be a primary distributor, there may be secondary distributors, tertiary distributors underneath. It may be a complex supply chain as it moves throughout the European Union. We also have other people who may be involved in manufacturing, and we need to consider in this sort of discussion. So, for example, you may have importers and distributors who take on repackaging activities. Perhaps they put in a local language labeling or some specific local language requirement of the health service for some additional labeling. We may have reprocessors of single-use devices which aren't returned to the original manufacturer. Maybe you have a reprocessed device, maybe that reprocessing is done by a subsidiary of your own company, but locally in a different country. Providers of systems and procedures packs, people who kit things together. And again, they have specific responsibilities for suppliers. Okay, so if we look at the big economic operators, the ones that we normally consider, we've got the authorised representative. And just as they did under the MDD, they assumed the legal responsibilities of the manufacturer within the European Union. But as those responsibilities are extended under the MDR, they're also extended for the authorised representative. And the new responsibilities under the MDR, which are a lot in the post-market surveillance and vigilance area, are now become under the remit of the authorised representative. So the authorised representative will need their person responsible for regulatory compliance. They still need to hold the technical documentation or have ready access to it, confirm the conformity assessment, and hold the declaration of conformity. They have the duty to provide labelling, deals with requests for information, translation, surveillance and vigilance reporting, complaints, CAPA activities. Crucially, they have the insurance, but they also now have a legal responsibility to be able to demonstrate that they have the financial resources to meet that liability. So that may be some form of bond, other financial instrument, or insurance that they need to hold. They need to have channels of communication, and they are the main conduit for communications between the competent authority and the manufacturer. They need to deal with local registrations within the EU, and they now have a very clear and explicit duty to fire the manufacturer, to decide that they're no longer going to go on in this role to get rid of the manufacturer if they are concerned about the compliance of the device. So, a bigger role for authorised representatives. Importers are now defined as an economic operator, and they pick up some specific duties to check the declaration of conformity, check that the manufacturer, the EUAR, the labelling, the instructions for use, the UDI are exactly as stated. And why do they do this? Well, in part, this is to make sure that there are no product mix-ups, but it's also to make sure that we're not dealing with a counterfeit product, that it is what it's supposed to be. Check contacts, check trademarks. They have responsibility for looking after the storage and handling of the device, following the general safety and performance requirements. And of course, to do that, they will need a quality system. And that quality system, pretty much the only harmonised one we're likely to have is 13485/2016. So while all standards remain voluntary, some are more mandatory than others. And again, for importers, 13485/2016, that's a standard most companies, most manufacturers are going to be expecting their importers to have, albeit not necessarily from a notified body, maybe from an accredited registrar of quality systems. And they've also got potentially some sort of role in complaints and vigilance, and for informing a competent authority that they have in relation to the product. The distributor has a smaller set, but the same sort of responsibilities. You see a lot of duplication here. This is what we mean by people being jointly and severally responsible. If there's a problem and three people have a duty to be looking at, for example, the declaration of conformity, one of them should pick it up. Okay, so how does this work with 13485? So what we have in the past is very much the manufacturer has their quality management system. As part of that, they put in place a contract and quality and technical agreement with the economic operators. And there may be some form of heads of agreement in there which says that they should have a quality system, they should do various things, and the economic operators written their own detail around that, depending how much of a formalised quality management system they have. And those heads of agreement will tend to specify the routes of communication between the economic operator and the manufacturer. One way of dealing with this under the MDR is going to be to extend the manufacturer's QMS into the economic operator. So if the manufacturer owns the economic operator, their EUAR or their importer or their distributor is a wholly owned subsidiary within Europe, then this is a very sensible and very logical way of doing it. But clearly it won't work if the EUAR is an entirely different company and deals with multiple manufacturers. No distributors really wants to be in the position where they have to work out of all the products they distribute who the manufacturer is and then look up that manufacturer's procedure for shipping the products out or for handling the products. It's untenable. So for a lot of the situation, what we have to look at is economic operators having their own quality management system and putting in place a manufacturer putting in place a contract with a quality and technical agreement that defines the communication between the economic operator's QMS and the manufacturer's QMS and deals with the assignment of roles. So there may be multiple companies in multiple roles. Many have joint and several responsibility on the product, and that gives them a primary fiduciary duty which exceeds any contract or agreement. So when they say they are liable for the product, they are really legally liable for the product. Don't take on the role of an economic operator lightly if you don't understand the legal responsibilities of it. There needs to be a strategic chain of command such that the manufacturer stays in control of their own product, but there's a degree of devolved tactical freedom because you have to give the economic operators the freedom to discharge their legal duties. And there needs to be an alignment of the various quality management systems and contracts